Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Abnormal electrocardiogram findings among older adults may be a sign of increased risk for coronary heart disease events such as heart attack or stroke, according to research published in the April 11th issue of the Journal of the American Medical Association. Some uses of ECG tests include determining if there is any damage to the heart, how fast your heart is beating and whether it is beating normally, and the size and position of your heart chambers. Researchers from the University of Lausanne used medical records to identify the presence of minor or major ECG abnormalities among more than 2,000 adults aged 70 to 79 who did not have any known cardiovascular disease. The investigators then looked at whether the presence of such abnormalities helped predict whether these individuals experienced a coronary heart disease event over an 8-year period between 1997 and 2007. Initially, 13% of the participants had minor ECG abnormalities and 23% had major. During the 8-year study period, 351 experienced an event. After adjusting for traditional risk factors for coronary heart disease, such as smoking and high blood pressure, having minor ECG abnormalities was associated with a 35% increased risk for coronary heart disease events, while major ECG abnormalities were associated with a 51% increased risk. When determining whether the participants were at low, intermediate, or high risk for a coronary heart disease event, adding ECG data to traditional risk factors resulted in more accurate classification. After 4 years, 208 participants had new and 416 had persistent ECG abnormalities. New abnormalities were associated with a twofold increased risk of coronary heart disease events, while persistent abnormalities were associated with a 66% increased risk. Today's research suggests that looking for ECG abnormalities in older patients can help more accurately assess their cardiovascular risk. For Insider Medicine in Depth, I'm Dr. Susan Sharma.